Hepatitis B is a serious liver disease. It is contagious, with no currently known cure. This and following episodes of Public Health Matters answer important questions about hepatitis B for both people at risk of infection and healthcare providers, including why is hepatitis B sometimes called a silent killer? How can you and loved ones avoid becoming infected? What populations are most at risk for infection? And what behaviors create the greatest risk? If a person does become infected, what are the warning symptoms? And why is it so very important to seek immediate medical help? How can the disease be managed with proper medical care? What about infection by expectant mothers? What about people with low or no income, including recent immigrants? What resources are available to help them? For answers to these and other questions about hepatitis B and other public health issues, listen to this and following episodes of Public Health Matters, featuring conversations with experts. Public Health Matters, brought to you by the Illinois Public Health Association. Welcome to this first in a series of discussions about hepatitis B and related public health issues, responses, and resources. This program is produced by the Illinois Public Health Association. I'm David Risley. One day, before we get started talking about hepatitis B, why don't you introduce yourself? Tell us a little bit about yourself and your background and how it is that you became involved with the Illinois Public Health Association regarding the hepatitis B issue.
Okay. So, as earlier introduced by David, my name is Monde Nyambe, and I am an African immigrant from Zambia, which is a country in the southern central region of Africa. I found myself at IPHA through a series of programs that public health programs that they run across the state of Illinois. And the first time when I came to IPHA, I came on board as an American member. So from way back, I have always been interested in learning about communicable diseases. And one area that I specifically focused my attention was the HIV and AIDS pandemic. And so when I heard that they had an opening about hepatitis B, I said, why not jump in and learn something new? And here I am today at IPHA and doing this really important and incredible work, spreading the news about hepatitis B across the state.
Well, let's talk about that. Let's talk a little bit about hepatitis. Most people have heard of hepatitis. Some may have heard there's hepatitis A and hepatitis B, and we're going to be talking primarily about hepatitis B.
Yes.
What is hepatitis, and what's the difference between hepatitis A and hepatitis B?
Okay. So hepatitis, just in general definition, is a serious liver infection that is caused by the hepatitis virus. So when we talk about hepatitis, there is about 5 different types of hepatitis. And there is hepatitis A, B, C, D, and E. So as David mentioned, for this podcast, we are mostly focusing on hepatitis B. So just the general difference between A, B, and C. So A, most cases, you acquire that from taking foods or ingesting foods or water that's contaminated with the hepatitis A virus. So in most cases, we've heard of lettuce that was contaminated a few years back. So if that food is contaminated with the hepatitis A virus and it's not properly washed or cooked, somebody might end up acquiring hepatitis A. In most cases, it comes from fecal matter, so it could be cow dung, it could be chicken manure or anything like that. As long as the food is not properly washed or properly cooked, then that individual is at risk of acquiring hepatitis A.
Now, if I can interject, now hepatitis A, while it's a disease and nobody wants to get the disease, at the same time, hepatitis A is not as serious in its effects usually as hepatitis B, the topic of our discussion today.
Yes.
Tell us about hepatitis B.
So hepatitis B is caused by the hepatitis B virus. And in most cases, it's transmitted through different ways. It's a very serious disease that if one has the disease, they will live with the disease for the rest of their life. One, there is no cure for hepatitis B.
Let me have you repeat that. There is no cure for hepatitis B.
Yes.
Once you contract the virus, at least as the state of medicine today, there is no known cure.
Yes.
It is a lifetime disease from then on.
Yes. Yes.
Now, what sort of, what is the effects of the hepatitis B virus on the body?
So on the body, when somebody has hepatitis B, it mostly affects their liver. So in this case, when somebody acquires the hepatitis B virus, it goes straight to affect the liver. So in most people, you will see signs like maybe yellowing of the skin because we know that the liver is unable to fight off that infection.
One of the things that I think it's important for people to understand is how hepatitis B can be contracted, how a person can become infected. It's it's different than hepatitis A.
Yes.
Tell us about that.
So, an individual might acquire hepatitis B by having unprotected sexual intercourse with another individual that already is living with the hepatitis B virus. The other thing is sharing needles. For example, in terms of drugs, so people that share those the drug equipment might end up having hepatitis B that way. Another way would be through mother-to-child transmission, and this is where a child acquires the disease before they are born. In terms of mother-to-child transmission, it is a standard and a good procedure for healthcare providers to screen expectant mothers so that they can know whether somebody is living with hepatitis B. And if somebody is found to be hepatitis B positive while they are pregnant, the primary care physician or the gynecologist or whoever their physician might be will be able to assist them in making sure that they get the treatment to protect the unborn child. And at the time when the baby is being born, they will take all the necessary steps to make sure that the baby is not exposed to the blood that is hepatitis B positive. After the baby is born, that child most likely will be given the first hepatitis B dosage just to make sure that the virus is not passed on to the baby.
Now that touches on the next topic I think people need to understand right up front before we get into these things a little deeper. And that is, we've talked about how hepatitis B is a serious disease. It's a lifelong disease, and it's contagious. In other words, it can be passed on to other people through unprotected sexual contact,
Bodily fluids.
and needles, sharing needles. And also, it can be passed on from mother to unborn child or a child after birth. And that's bad news. The good news is that it is highly preventable.
Yes.
Tell us about how it's to be prevented.
Okay. So the main way is to make sure that whenever somebody is having sexual intercourse, they protect themselves. And you can also prevent acquiring hepatitis B by getting vaccinated. So we are talking of a vaccine that's not well known by a lot of people. So yes, there is a vaccine for hepatitis B. And if one needs to get the vaccine, that's a conversation that they can have with their primary care physician. In an instance of one not having a primary care physician, there are so many FQHCs and county health departments that do offer hepatitis B vaccines.
Now, one of the things, as I understand it, is that if a person is exposed, knows they've been exposed to the hepatitis B virus, it's important for them to contact a physician immediately.
Yes.
Because if preventative measures are taken within 24 hours, then there's a pretty good chance that they can avoid becoming infected themselves. But it has to be immediate.
Yes, it has to be immediately. If you contact either your local health department or the primary care physician, explains to them what happened within that 24-hour window frame, then they might be able to give you a prophylaxis to help minimize the chances of one acquiring the hepatitis B virus.
You just used a big word. Will you explain that?
So a prophylaxis is a medication that's used to prevent an infection. So for example, we do have pre-exposure prophylaxis for HIV. For people that are in relationships where one of the partners is HIV positive, they can receive PrEP to protect them from acquiring HIV. So similarly with Hep B, they can speak with their primary care physician, and the primary care physician would be able to order that medication for them so that they can quickly be treated or quickly be assisted in preventing further disease.
Now, this is important because the disease is highly transmittable and it's serious. But if a person becomes infected with the disease, there are also medical measures that can be taken to help them learn to live with it and minimize the effects.
Yes.
But also, if a person finds out that they have unknowingly or knowingly become exposed to hepatitis B, if they seek immediate medical attention, they may be able to avoid or at least minimize the effects of the virus.
Yes.
And it's important, therefore, that people who have become infected understand that it's not that their lives are over and that they can no more have normal life and normal family life, normal marital life, that there are measures that can be taken if they face it head on and don't try to deny it or cover it up.
Exactly.
Just deal with it.
Yes.
But deal with it with medical professionals.
Yes. So if one is unsure about their hepatitis B, either risks or their hepatitis B status, they can actually have a conversation with their physician and request to be tested for hepatitis B. So in a scenario where somebody gets tested for hepatitis B and they are found to be negative, then they can go ahead. Their physician would probably encourage them to get vaccinated against hepatitis B. And once somebody is vaccinated, it lasts forever. But that might not be true for everybody. If you feel like there is, you are among the populations that are at high risk, maybe this is a conversation that you can have with the primary care physician so that maybe after 20, 30 years, you can get a booster shot. But in most instances, people that get vaccinated for Hep B, as long as they get all the series, that is 3 to 4 shots, then they are most likely protected for life. So that's for somebody who tested negative. In an instant that somebody tested positive, their primary physician would be able to refer them to a hepatologist or a specialist that deals specifically for hepatitis B. So when they go for their specialist visit, the specialist visit might either do more blood work, they might do a liver function test, and they might also do an mRNA testing to detect the levels of the virus in the system. The liver panel will be able to show at what capacity or at what percentage the liver's it's functioning at. And once they do all those tests, in some cases, you might be found that your positive results from your PCP might actually be because one was already vaccinated, so they have immunity, or one was exposed to the Hep B virus, but the body managed to get rid of it. In that
For
case,
example, with a low dosage or something like that.
Yes. So in that case, then the specialist would refer that individual to go either get vaccinated or they'll find other ways of making sure that this is a false positive. And if after doing the series of testing, you are still found to be Hep B positive, then that specialist will make a decision based off of the results. So if the results show that there is no significant damage to the liver, it's either they'll put them on medication, antiretroviral medication, or they might just say, let me watch how this pans out. And usually they do a 6-month follow-up. And in that 6-month follow-up, they'll be able to look at each and everything that they tested the previous time that individual was there. And the specialist will be the one to make the call whether that individual needs to be put on antiretroviral drugs. The main reason why they would put somebody on antiretroviral drugs is because they don't want the liver to be damaged further. Because if the liver is cirrhotic, then the chances of reversing that are really, really slim. So to the point where David said, if you have hepatitis B, it doesn't mean that that's the end of your life. That's very, very true, because there are these life-saving measures that are put in place to make sure that the quality of life for that individual is at the optimum.
So here's the important points. Number one, it's avoidable.
Yes.
It's avoidable 2 ways. One, by behavior.
Yes.
Avoiding the things that would cause one to become infected. And number 2, by being vaccinated, so that if you become exposed, you do not become infected. Your body can deal with it, fight it off.
Yes.
And if you become infected, it is manageable with proper medical help. So if a person thinks they might have become infected or exposed, it's very important for them to immediately seek medical attention. Now, let's suppose that they don't. Now, what are the symptoms? What are the things that people would be looking for? As I understand it from looking at information from Mayo Clinic, the symptoms may not actually show up for up to 4 months.
Exactly.
Oftentimes within 2 weeks, but it may be longer.
Yeah.
And so some people might just be in denial. And it's a mistake to wait until the symptoms appear before you seek medical help. But maybe you don't know you've been exposed. And so then symptoms start to appear. What sort of symptoms would be the warning signs?
So, one thing that I might say about that, David, is that hepatitis B is a silent killer. And what I mean by that is people can live 20, 30 years without knowing that they are carriers of the hepatitis B virus. So in an instance where somebody starts showing symptoms, then the disease has probably progressed. So some of the symptoms that one might start seeing, the obvious signs might be somebody having the skin changes, looking yellow. They become jaundiced, right? So their skin will look yellow. And the other symptom to be watchful for would be when one goes to the bathroom, their stools look kind of like clayish, the color of clay, which is kind of like grayish, right? If you think of clay, it's kind of like a grayish color. So if the stools look that way, they might also have abdominal pains, indicating that maybe there is a problem with their liver. They might also be dark urine.
Dark urine?
Yes.
Okay, by dark.
So like it's just dark, like yellow, because that jaundice is coming out through the urine.
So even if you're properly hydrated, if you're not properly hydrated, your urine will be dark anyway.
Exactly, yes.
But this is something different. This is even if you're hydrated.
Exactly. So they might have loss of appetite, nausea or vomiting, and they might feel some weaknesses or just constantly being fatigued. So they might also have fever. And this is true especially with the fever, like the area where I come from. We most often don't go to see a doctor when you're not feeling well. In most cases, you just treat the obvious symptoms like a fever, right? I'll be like, oh, probably I have malaria. Let me just take some Tylenol and I should be feeling well. Well, you might take the Tylenol and feel better, but the damage being done inside is significant. So it's always very important if you see these symptoms persisting, it's always a good thing to go seek medical attention so that they can rule out some of the things. For example, they can test you for Hep B, and if they determine that, okay, you are fine, then that's a good thing. So it's always best to know versus always be like just guessing like, oh, I took Tylenol and I felt better. Yeah, you might have felt better, but what's really happening inside, you don't know.
Well, this is important because I think it's a natural human reaction for many people to, if they may fear that it's something bad.
Yes.
But they deal with that fear or that anxiety by pushing it aside.
Exactly.
And in essence, they try to be their own doctor.
Exactly.
And instead of going to their doctor or the public health department to find out what's really going on, and they may get good news, which is then they can get rid of the anxiety.
Exactly.
But on the other hand, if the news is bad news, they need to know it now.
Exactly. And have it taken care of, right?
deal with it.
Yeah, yeah.
Well, this has been a problem, as we've seen, during the COVID pandemic, when there are people who have become infected, but they tell themselves, well, it's just a cold or it's allergies or something. And here they are contagious and spreading the virus
Yes,
because they were in denial.
exactly.
So I think part of what I'm hearing you say is, don't do that.
Yeah,
Let's be realistic about this. Let's deal with it for what it is.
exactly.
And if the news is bad, then let's get
Follow
it treated.
the proper channels.
Follow the appropriate procedures to minimize the effects.
Yes,
And if the news is good, then let's do things to prevent this from happening,
yes.
so that we don't have to live with
Anxiety.
with the anxiety, or be infectious, unknowingly infecting others. Be responsible. As you said, a silent killer, if someone can have the virus and not know it,
Exactly.
and yet transmit it,
Exactly.
that's dangerous.
It is very dangerous, and that's one of the other reasons why when somebody tests positive for hepatitis B, they recommend that even other family members get tested, because unknowingly one might have exposed their family members. So getting tested and making sure that the family members are kept safe should be a good thing to do, because hepatitis B is a bad disease. It's the effects are very hard on an individual. Worse still for the family members that have to care for that individual.
But it's preventable, and it's, for the most part, manageable.
Manageable. As long as
you get the proper medical help.
Exactly.
Don't try to be your own doctor.
No. That usually doesn't work when it comes to hepatitis B.
Thank you for joining us for this first of a series of conversations with experts about hepatitis B. Our next episode will continue this conversation and answer further questions about what populations are most at risk for becoming infected with hepatitis B, questions about international travel to other countries, and about incoming immigrants, and what medical and other public health resources are available to help people with low or no income. So, please follow this program for those and other conversations with experts about public health matters. And please help spread the word by sharing links to this program on social media or on your own websites. Public health matters. Public Health Matters, brought to you by the Illinois Public Health Association.